Good morning, everyone. Welcome to the third and final day of Uniting to Save World Cultures, investigating the attributes of successful emergency cultural heritage protection interventions. My name is Cory Wagner. I am the Cultural Heritage Preservation Officer in the Office of the Undersecretary for History, Art, and Culture at the Smithsonian Institution. Today, I do want to remind you, first of all, that we're being live webcast, so please be aware of that, and that we are tweeting on hashtag Unite to Save. So please add your comments as we're going through our final day. And also that the webcast will be edited and archived on our website, unitetosave.si.edu. So this morning, I'm very pleased to be able to introduce Dr. Debra Ford as our first introducer. Debra and I have been friends for a very long time, and I have always been struck by her. She's a communications expert and professor at the University of Kansas School of Nursing, and I've always been impressed by her commentary about organizational communication and structures, and maybe not always understanding what it is exactly that she's doing, but I always felt like it had some really strong applications for what I was doing. So that's why we invited her to the conference today. She's the Leadership Program Director at the University of Kansas School of Nursing. Please welcome Dr. Debra Ford.
They're right, it is blinding up here. Good morning. I want to thank Cory and Brian for the invitation to join all of you this week. It's been an honor to learn from all of you and to be inspired by your passion. Thank you for that opportunity. As Cory said, my name is Debbie Ford. I hardly ever answer to Debra. As Stefan Simon said, I am one of the interlopers. But I'm used to being an interloper. My degree, as Cory said, or degrees are in communication studies, but most of my career has been spent in nursing education. As Cory said, I'm the program director for the leadership program at the KU School of Nursing. And what we do is, what our area does is help systems improve in healthcare. So my responsibilities include helping students learn about organizational leadership itself, nursing informatics, if you've heard of electronic health records or the electronic medical record, that's that area. Public health nursing and clinical research management, or helping people run clinical studies more effectively. I also have dual appointments in communication studies and health policy and management. Before this week, everything I knew about preservation of cultural heritage came from two places. One graduate course in cultural anthropology, and from Cory Wagner. That, however, does not make you a specialist in preserving cultural heritage. She's really good, but that's not enough. So why I'm here is because of my research specialties in organizational communication and health communication. And specifically, I conduct research and teach in organizational rhetoric, leadership, interprofessional healthcare teams, and interorganizational communication. So the focus of this panel is negotiations and collaborations during and before and during crisis, and after. Specifically, 4 questions are posed for this panel. What questions must be overcome for a successful cultural preservation project during an emergency? How were these issues addressed? What successful collaborations resulted? And what kind of support would be needed from the heritage community in emergencies to support collaboration? So in order to frame this panel, as well as highlight several issues that have emerged as themes from the conference, I will, naturally, focus on communication and interorganizational collaboration. To begin, I work from the following definition of communication, and that is very succinct: human, symbolic, action. Those 3 words are chosen very carefully. Human, because we're not going to discuss whether I can communicate with my dogs, although there are people who do study that. Symbolic, because it is an inclusive term, one which I think you will agree with. It not only includes the words we use, but also the nonverbal and all of the material and intangible heritage that you've been talking about this week. And third, action. Action is very carefully selected as well. It implies that what we're doing when we're communicating requires focus and energy. It is not just something that happens. There's a process going on. That word is selected very carefully from pragmatic philosophy for some of those of you who may have studied that. The philosophers in my head are Richard Rorty, Ralph Waldo Emerson, John Dewey, Charles Peirce, and William James. I also subscribe to some of the philosophy from Anthony Giddens, the sociologist, who talks about structuration. All that pulls on this idea of action, words as being an action that you take, and that those words have consequences. They help frame what can come next. What you say in the first sentence frames what can be said next. So some of you may say, yeah, that's easy. Anybody can communicate. We do it all the time. I respond to that in two ways. First of all, communication is simple. If I showed you the model, nothing on there would surprise you. It is not aerospace engineering, which is what my nephew majors in. It doesn't look like that at all. But it is simple, but it is not easy. Communication is happening all the time. Communicating effectively, and on top of that, collaborating, are the issues. So in any communicative situation, we are all trying to achieve three things. First, an instrumental goal. Your instrumental goal is basically what you want to accomplish. So you're trying to recover cultural heritage in extremely difficult circumstances. Two, you're also trying to achieve a relational goal. In any conversation, even short ones, in any conversation, you're trying to build a relationship. You cannot recover cultural heritage alone. All of the papers this week have demonstrated that very clearly. And third, you're trying to achieve an identity goal. You're working to be credible. You're also working to be validated as you are in several contexts that are occurring at the same time. So the problem is to communicate effectively, you have to work on all three goals simultaneously. You have multiple goals, multiple relationships, and when you're doing interorganizational collaboration, you're representing multiple organizations, multiple identities, multiple countries. That's why it very quickly becomes more complicated than we give it credit for. And all you have to do that is words. So that is why I argue that communication is simple, but it's not easy. Communicating effectively is hard work. It helps if you have trust in your relationships, and has been argued here in several papers. That doesn't begin when the disaster hits. It, as has been said, it begins way before in the relationships you build before the threat occurs. And I've seen it happen all throughout this conference. You're either building new relationships or continuing to build the relationships that you had coming into this conference. Building on that foundation, now we move to collaboration. Keaton, Smith, and I have argued that collaboration is both a structure and a process. So you can say, we did a collaboration. But to make that collaboration, you had to collaborate. And to collaborate, you had to communicate. So to solve wicked problems, like preserving cultural heritage, what we have to do is learn to somehow work with that process more effectively. And just as a short definition, wicked problems are problems that have no right answers. They're difficult, they're complicated, and the answer is not waiting out there for us to discover. We have to invent the answer. So you have discussed several times about culture as an issue of identity. When we attempt to collaborate to solve problems, to achieve our multiple goals, we are not only talking about how we identify with our culture, but also our personal identity, our professional identity, our identity as it's constructed through the organizations we work with and represent, as well as our countries. Again, that's why it's very complicated very quickly. You are not imagining that it really is more than we give it credit for. So what can we do? How can cultural heritage professionals collaborate in these complicated, high-pressure situations in which cultural identities are threatened? The core of who we are is threatened. I ask you to consider one strategy as a starting place. There's a lot of things we could do, but here's one strategy to get us started. The focus on words having consequences means that we have an opening for change. We can change what we say, and by doing that, have different consequences over time. So it's very minute changes that could have very big consequences. It won't be easy and it won't be quick, but by changing how we talk, even minutely changes those consequences. My recommendation to consider is to keep a mission focus. For those of you who study leadership, that will not surprise you. What I'm going to argue is there's a particular way to keep that mission focus. It would help us break the reification of how things have been done. It gives us an opening for change. So how can we achieve that? I recommend an obvious focus, but sometimes, as the philosopher Wendell Johnson said, the obvious is more difficult than the obscure. So what I suggest trying is to centerpiece preserving cultural heritage in your conversations, in your mission. Use cultural heritage as your compass when you're working together. So you keep that kind of like right out here in between you and between us when we're working on these. So how do you do that? Okay. Gives that space for conversation to occur. People from diverse backgrounds, gender, ethnicity, geography, politics, countries, religions, and representing multiple organizations can come together to share expertise and solve problems. So I'll give you an analogy from healthcare. Not surprising. Many of you might be familiar with the United States healthcare system. We spend the greatest money on healthcare in the world, and we have some of the worst outcomes. This is a wicked problem. So, in order to work to try to change those wicked problems, the system has to change in order to improve the health of anyone who seeks care in our system. So, we've made a start. It's a very small start, but it's a start. The conversation centerpiece, the compass, has shifted. When it's about physician incomes and control of the healthcare system, when it's about nurses' scope of practice, conversations, when it's about saving money for insurance companies, when it's about who gets the credit, healthcare teams fail. So I'll say that again. When it's about physician incomes and control, when it's about nurses' scope of practice, when it's about the role of the pharmacist, the physical therapist, the respiratory therapist, when it's about saving money for insurance companies, when it's about who gets the credit, the teams fail. Okay, so what? Teams fail. When teams fail, we have evidence now that shows when healthcare teams fail, patient care suffers. Sometimes patients get the wrong leg operated on. Sometimes changes in patients' conditions are not recognized because the wrong person saw the change and they didn't get listened to. Sometimes patients die. But when the conversation is about safe, high-quality, affordable patient care, it's now called the triple aim. When it's about the patients and then the providers, then it's a whole different conversation. So I'll give you an example of how that mission focus changes. It's a difference in approach when the patient when the patient is the focus and not who's doing the work. One of my students just finished her master's program. She is now a nurse director of emergency department in a medium-sized acute care hospital in central Kansas. She has evidence, as most hospitals do, that the sooner you get a particular medication after stroke, you have a better chance of recovery. Much better. The faster you can get that care, the much better off you are going to be. So the emergency department calls that door-to-needle time. Needs to be as short as possible. Before changing her mission focus, she would have said, here's what we need to do, and here's how we need to do it to get the system to change. She believes in the evidence. The evidence is strong evidence. Here's how we're going to get it done. She might have changed a little bit. It's probably a change that would not be permanent in her healthcare system, her department. Her new focus, what she would say, in this case, is here's the studies that show what we need to do. The next step she would do is bring the right people to the table Cory Wagner is really good at that, bringing the right people to the table. And then say, how are we going to do it? Not tell them how to do it, ask them, how are we going to do it? So she did. And let them, give them enough wait time, and then let them contribute their ideas. So one person said, all right, I can give you 2 minutes here. And whatever that process is could change. And then other people said, I can give you this much time, I can give you this much time. Their door to needle time went from 60 minutes to 45. You changed 15 minutes in an emergency room. That's amazing. Think what that means to that patient and his or her recovery. This is what I'm suggesting as a strategy to act on or to incorporate, is to stay focused on saving cultural heritage in any particular context. Disaster, conflict, whatever it is that is generating the issue. Keep it focused like a compass in any country and less on all of the many issues that all of you face, both individually and organizationally. So I don't know what that looks like for each of you. I don't do what you do. But if you keep that mission in between you, it may help change the conversation and you may have different outcomes. I believe it's one reason Cory is successful at what she does. I believe from what I understand is why Richard is as successful as he is, why Olsen John Julian is as successful as he is. They are mission driven, not to the exclusion of everything else, but they're mission centered. So, the rest of the panel today features 3 papers that, whether they realized it or not, illustrate centering that mission. We have Fahim Rahimi in his case study of the National Museum of Afghanistan Collections. He argues that public awareness of the museum needs to be built earlier and in more depth. Jessica Johnson in her case study of the Iraqi Institute, building community that transcends gender, language, ethnicity, politics, religion, and geography, building sustainability, and building a collaborative mindset in local areas. And Richard Curran in his case study of the Haiti Project, where he discusses many things, but one of which is activation of networks and multiple networks, recommends asking what is needed, not asking what is needed, not telling what is needed, and persistence. In that sense, it may help you unite to save culture. I'm happy to introduce Fahim Rahimi from the National Museum of Afghanistan Collections.